6 of the cases were in quarantine during their entire infectious period, at least 17 infectious in the community. We have 10 people currently hospitalised, 3 in intensive care, all requiring ventilation. Very strong testing numbers yesterday, 3,485, so we continue to see very strong testing. Again, the reminder every day, if you've got any symptoms, we really do need you to come forward and get tested straight away. That not only helps reduce the number of infectious days in the community, but it will also help if you are diagnosed earlier with treatments to help you recover from COVID. The vaccination front, over the next few weeks, our absolute priority is to ensure that everyone who wants a vaccine has the opportunity to get one. We have earlier Pfizer appointments available at ACT government mass vaccination clinics. 7,000 text messages were sent out yesterday to people who already had a booking in the system at an ACT government clinic, inviting them to bring their appointment forward. Yesterday, more than 3,000 appointments were brought forward. There are also a significant number of appointments available at GPs and pharmacies for Pfizer and Moderna over the next few weeks. So please try and bring your booking forward. A more vaccinated Canberra is a safer Canberra. From today, I can announce that Canberrans aged 60 years and over are now eligible to book a Pfizer appointment at an ACT government mass vaccination clinic or through a local GP. The Moderna vaccine is also available for Canberrans over the age of 60, and Moderna is delivered through local pharmacies. Importantly though, mixing vaccines is not approved in Australia at this time. So it is not possible to get an mRNA vaccine, a Pfizer or Moderna second shot, if you have received AstraZeneca as your first dose. If you have received a first dose of AstraZeneca, you must receive a second dose of AstraZeneca. What I can say is that based on the Commonwealth Government's forward vaccine orders, for those who have had 2 doses of AstraZeneca, mRNA booster shots are what the Commonwealth are proposing for everyone next year. As a result of the excellent vaccination coverage in our over 60 population, the ACT government will be able to close the Calvary AstraZeneca clinic from Friday the 8th of October. We have only 30 first dose bookings and 1,178 second dose bookings at the clinic that remain to be administered. These will be brought forward and managed. If you are still waiting for a vaccine, please call our vaccination booking line or log into the My Digital Health record system to bring your appointment forward. Now, as reported extensively in the media this morning, the Commonwealth Treasurer and I have reached agreement and announced an extension of the ACT's COVID-19 business support grants. Under the agreement with the Commonwealth Government, there will be an additional business grant extension payment of a further $10,000 for all employing businesses and a further $3,750 for non-employing businesses. This takes the baseline payment to $40,000 for employing businesses and $15,000 for non-employing businesses. In addition to these baseline amounts, another top-up payment will also be made for medium and larger businesses in the ACT. This is scaled based on the turnover of those businesses. I could also advise that businesses in the fitness and sports industry, such as gyms, personal trainers, dance teachers and instructors, will now be included and able to apply in our COVID-19 tourism accommodation provider, arts, events, hospitality and now fitness grants scheme. Details of the expanded business support program, can be found online at the ACT Government Business Hub. Now, before I conclude today, it's important to stress the importance of making an earlier vaccine booking. Really want to reiterate that point to everyone, that there are earlier appointments available, and we are very keen to give everyone the opportunity to get at least a first dose before we come out of lockdown in the middle of October. This morning we'll be joined for an update on the overnight cases and epidemiology by the Deputy Chief Health Officer, Dr. Vanessa Johnston. We'll also be joined by Dr. Elizabeth Moore, who's the Coordinator General of the Office of Mental Health and Wellbeing, and Minister for Health Rachel Stephen-Smith will also provide an update. So for those who've joined late, a quick recap of the overnight cases: 31 new, 17 of them linked, 14 still under investigation, only 6 in quarantine during their entire infectious period, at least 17 infectious in the community, 10 people hospitalised and 3 people in intensive care, all requiring ventilation. And a big shout out and thank you to all of the staff in Canberra Hospital, Calvary Public Hospital, and indeed across the health system, who are providing such wonderful care and support for people who have contracted COVID, whether that's in the intensive care unit, in acute care within the hospital system, or the hospital and the home program. Thank you to all of those staff and all who support those staff to provide the care and support that hundreds and hundreds and hundreds of COVID positive patients have experienced, and indeed the care that they need as we go through this pandemic. I'll now invite Dr. Johnston to provide an update on the overnight cases.
Good morning. I'm Dr. Vanessa Johnston, the Deputy Chief Health Officer of the ACT. So, today's numbers. We have 31 new COVID-19 cases that have been notified since our last update. So this number is higher after yesterday, and while we do expect our cases to fluctuate, we'll be keeping a very close eye on the situation. This is a reminder that everyone needs to remain vigilant. This is particularly important while we're in lockdown and we're still working towards our higher vaccination targets. The total cases for this outbreak is now 835, with the total number recovered at 588, so that's 21 more than yesterday. Our team continues to manage 246 active cases. Of the new cases today, I can confirm that out of the total 31, 17 can be linked to known cases or clusters, with 14 still being under investigation. Of the 17 that are linked, we also know that 8 are household contacts. Out of the total 31, 6 were in quarantine for their whole infectious period. Of the remaining 25, 17 spent some time in community for at least part of their infectious period, and 8 remain under investigation. To 8 p.m. last night, we have 10 people in our hospitals. 3 of these people are in ICU and they're requiring ventilation. I've also become aware that there's 1 additional case that has been admitted to ICU overnight. They'll be included in tomorrow's update. So of the total 10 from last night, 7 are unvaccinated, 2 have had 1 dose, 1 is fully vaccinated. None of the patients in ICU are vaccinated. The youngest patient in our hospitals currently is in their 30s and the oldest is in their 80s. As I mentioned yesterday, there are additional cases linked to the Calvary Hayden Aged Care Facility cluster. In today's numbers, we include 2 residents and 1 staff member. So our numbers are now at 17 cases for this cluster, 4 staff members, 12 residents and 1 household contact. Calvary has advised that at this stage none of the current cases are hospitalised due to COVID-19. Some of them, however, are symptomatic and are being well managed in the facility. Calvary Hayden is continuing to communicate directly with all of the residents across the facility, as well as their families, regarding the way forward. So following the addition of the Calvary Hayden Aged Care Facility and the London Circuit construction site to our exposure list this week, and after our ongoing investigations, we're now adding these to our active public sites of transmission. That brings these public sites of transmission to 3. Calvary Hayden Aged Care Facility, and I said there's a total of 17. London Circuit construction site has a total of 17 cases, and Ainslie Village with a total of 13 cases. So again, please check the website, check it regularly. If you've been to any of the locations listed, please follow the public health advice. So we're heading into the mental health month this October, and so my shout out and thank you today is for the entire community of professionals that support the work in our mental health sector. So this includes our own mental health and wellbeing team in the HEC, our clinicians, counsellors, and our non-government community partners that all come together to provide a range of support and assistance programs, particularly during this stressful time. The current environment is affecting us all in different ways, and while the restrictions of movement in the community certainly help with minimising transmission of COVID-19, we recognise that they can have a major impact on people's health and mental health and wellbeing. So I know that being in lockdown has been tough. It continues to be tough for everyone, including our essential workforce that continue to leave their families, those who work in high-risk situations, our parents and carers who are juggling home responsibilities, homeschooling and working from home, and our kids who are spending their school holidays in lockdown. So please remember, it is okay to feel worried and anxious at this time. It is okay to not be okay at this time and to reach out for support. So please do so if you need it. So I'd now like to hand over to Minister Stephen Smith for her update. Thank you.
Thank you, Vanessa, and good afternoon, everybody. Today I'd like to provide an update on visitor restrictions for aged care. This is something I know we've had a few comments and questions about, and I know that the family and friends of people who live in aged care facilities, and indeed the residents themselves, are anxious to know when they will be able to be in face-to-face contact again, when people will be allowed to visit aged care facilities. At this stage, as we remain in lockdown, no visitors are permitted into aged care or other residential facility settings except for end of life or other compassionate reasons as approved by the facility. We recognise that this is really hard for people with loved ones in aged care facilities, and I want to thank everybody affected for their understanding and their patience as we continue to work to protect residents. While you are unable to physically visit your loved one, of course, we really are hoping that everybody is staying in touch by phone and by video. And I know that some of the facilities are doing an incredible job enabling people to stay in touch with their families and friends. Please call your facility to coordinate contact through staff if they don't if you don't have that personal phone and contact connection. You're also allowed under the public health directions to deliver essential items to an aged care facility, but again, you should check with the facility their requirements around contactless delivery or how they expect that to work for their particular facility. If you do need to visit for end-of-life or compassionate reasons, please coordinate this through your aged care facility. They will advise on the number of visitors that are allowed and the times that you're able to visit. If you're in quarantine, unfortunately, you cannot visit an aged care facility. And of course, that is to protect the residents in that facility. As we reach higher levels of vaccination and we do start to ease restrictions from the 15th of October, there will be opportunities for Canberrans to visit their families and friends in aged care again, and I know that that will be most welcome. The pathway forward that was released the other day indicates that from the 15th of October, visitors are to comply with the policies that are established by the relevant residential aged care facility. So I guess my message today to those aged care facility managers is that they should be working on their own policies and working with residents and staff and families to ensure that everyone understands what policies will be applied from the 15th, and to families and friends to be in touch with the residential facility in which your loved one is a resident to understand what their policies will be from the 15th of October. Before I hand over to Dr Moore, I just also want to provide a quick update on the situation in relation to the Ward 10A outbreak at Canberra Hospital. Day 5 testing took place on site at Canberra Hospital yesterday, as well as through priority testing at Epic for staff. As we all know already, 3 patients have tested positive for COVID-19 in total, the initial 2 patients announced over the weekend, and a 3rd case announced on Monday, the 28th of September. 2 positive cases are being cared for in the COVID-19 ward at Canberra Hospital, while 1 patient has been discharged. All other patients in Canberra Hospital in Ward 10A have returned negative results. No healthcare workers have tested positive in relation to the exposure at this time. 47 staff remain off work in quarantine as a result of their potential exposure. Ward 10A currently remains closed for admissions, and the opening date will be determined soon. But the fact that all of these tests have come back negative is such a good sign of the effectiveness of Canberra Hospital's infection prevention and control and use of personal protective equipment. And I again want to extend my thanks to those staff who are caring for patients on Ward 10A. We know it's a very difficult time. To the patients themselves and their families, thank you for bearing with us in this. And to all of those at Canberra Hospital and indeed across our health system who are doing the right thing, following infection prevention and control procedures and wearing their PPE appropriately, this absolutely makes a real difference in the outcomes when we see unexpected COVID positive cases emerging in our health system. So thank you for that. And with that, I'll hand over to Dr Elizabeth Moore, the Coordinator General for Mental Health and Wellbeing.
Thank you, Minister. Any day is a good day to talk about mental health and wellbeing, but especially over the last month, because October is actually Mental Health Month. It's also National Safe Work Month, and National Carers Week occurs in October, and now we have the pathway forward. We have lived through times of uncertainty, and my thanks go to the community collectively for actually approaching this with a very pragmatic view. To all those individuals who've actually shown us different ways of coping, and to, of course, all those people that have had to go to work and had to maintain their own self-care. There are, of course, different ways of coping with anxiety and with stress. We have, unsurprisingly, seen increased rates of psychological distress in the ACT, very similar to the rest of Australia. Our anxiety, especially in young people and in people 35 to 40, has increased. But what is anxiety? Do we actually think about it? Anxiety is normal. As Vanessa has said, it's okay not to feel okay, but there are things we can do about it. We all have different levels of anxiety. Some people have very low levels of anxiety, and it takes them a lot to tip over into where they can no longer function. Others of us have a higher level of anxiety, and we need to manage our anxiety. We can learn to manage it, and different strategies work for different people. So I thought in this press conference we'd actually look at some resources that might help people. There is a master digital resource called Mental Health Prac, EMHPRAC, which is a minefield of digital resources that many people have found helpful in managing their anxiety. Especially for young people, there is Reach Out. There is the Headspace. There is also Emerging Minds. Emerging Minds is actually an ANU-led website. It has a section for kids, it has a section for carers and teachers, and it is a really good resource if you're having trouble talking to your kids about COVID. Many people don't know that online interventions can be extremely effective. And there are some apps, especially for the Aboriginal and Torres Strait Islander community. There is one app called iBobbly, IBOBBLY, that many people in the Aboriginal and Torres Strait Islander community have found very helpful. And the website especially for Aboriginal and Torres Strait Islanders called Wellmob. Of course, Beyond Blue has a COVID forum. So some of those anxieties that we all have around COVID, you can explore through that forum. Well-being is another concept that we throw around a lot. But there are things that we can actually do to manage our well-being. And we've talked about these before in terms of needing to schedule time for self-care. How many people here actually schedule time for self-care? So those are things like looking after your physical health, making sure that you are actively exercising. And by the way, exercise in a green space is more effective than physical exercise alone. And Canberra is well served by that. Use your 4 hours well. Take the time to reflect during Mental Health Month. Actually have a look at your sleep patterns. There's a huge body of evidence around sleep. If you have ineffective sleep, so sleep that is too small, or sleep that is altered by things like excessive alcohol use, there is less well-being. Don't forget connectedness and kindness. So the shout-outs seem to have been a regular feature of these press conferences, which is great, that people take the time to actually acknowledge the work that other people are doing. So I'd like to give a shout-out to Dr. Karen Coleman, Dr. Vanessa Johnson, and all of the media team that actually keep us informed. This is a reliable source of information. One of the things we know increases anxiety and reduces well-being is if you can't switch off. So make sure, if you can, that you are only listening to reliable information a short amount of time, not all the time. And don't forget to switch off your blue screens before you go to bed. So really my main messages today are that anxiety is normal, that we need to manage our anxiety when it gets out of control so that all of us are able to manage whatever comes over the hill next at us. I hope you take the time during Mental Health Month to actually look at some of the resources that are available, the mental health champions that have put their hands up to say, hey, I have a lived experience of mental health issues and this is what's worked for me. It may work for you. Thank you, and I'd now like to hand back to the Chief Minister.
Thank you very much, Dr. Moore. Happy to take questions.
Chief Minister, can we just get a breakdown of the business payments that have actually been paid out versus approved versus either rejected or not approved since the plan began?
Okay, so from the first 2 days of the scheme, 2,458 applications were received. I'm advised that 90% of those have been paid. We're still awaiting further information on 5%, and around 5% have either been declined, they were duplicate applications, they've been cancelled by the business, or the payment bounced back. For the balance of August, there were about another 1,500 applications that came in. So to the end of August, we had a total of 3,951. Of those, approximately 80% approved and paid, 15% still awaiting further information, and around 5% declined, cancelled, duplicates or bounced back. As of last 15 minutes or so, I'm advised that we can expect today that we will have approved approaching 5,400 applications to the value of around $85 million. There are 1,754 that are still awaiting further information, and 1,407 that have undergone partial assessment and will move into the next phase of assessment. So what we're seeing is that we're still getting a couple of hundred new applications each day, but those that were lodged in the first week of the scheme have predominantly been paid, unless there's a reason that they can't be because there's a lack of information. And then the team are working through hundreds and hundreds each day, approving and making payments. But if you only lodged your application last week, then it won't have been paid yet.
And I understand, talking now about the second tranche of payments, they were supposed to be automatic. What percentage or how many of those have now been paid?
So as we've added to the dollar amount each time, when payments, so for example, if your application is in, when you lodged it and you thought you were getting 20,000, but now you'll be eligible for 40, you'll get that 40,000. You don't need to resubmit. So every application that was paid prior to an amount being extended, so for example, if you were paid in the first 7 days of the scheme at the $20,000 amount, then you may not yet have received your top-up payment of the other 20,000, noting that the 10,000 was only announced today. So the team you will already have been approved, and they will just go back and effectively run the payroll again. But that won't have happened yet for every single business. But if you've got an application in the system now that hasn't yet been paid, you'll be paid the 40,000 as a lump sum. I do not have the detail in front of me of exactly how many businesses have been paid the different amounts. What I've got is the total number, and so that is expected to cross $85 million across nearly 5,400 thereabouts businesses by close of business today.
And I've been hearing from a couple of businesses who were approved and paid, really early on, who still haven't had that second set come through.
Yeah, it will come through. I don't know when yet. I'll get some further advice on that.
Okay, so that sort of leads to my next point. With this added amount and some businesses still waiting weeks currently to be paid, how is the government planning to get through this backlog in the next 2 weeks? So
the prioritisation is those who've been waiting longest and those who haven't received any payment.
Is there any way that we can speed it up to, can we guarantee that it will come through in the next 2 weeks before mid-October?
If people submit a complete application, yes. But the problem is a significant number we've had to go back and ask for more information. Sometimes people put the wrong bank account in. We've had payments bounce back, and we've got a 5% rate of either declined or duplicate applications. So there's a need to assess every single application, that's clear.
Chief Minister, some announced the flag they'd like to roll back into Canberra pending approval. Given Epic is currently a testing site, would you be happy for an event like this to go ahead, and could it be the catalyst for other events like the Canberra Show, for instance, the Folk Festival?
Look, yes, we'll do what we need to accommodate events at Exhibition Park, and that may mean either temporarily or permanently shifting testing sites next year.
Does it give you some confidence about that economic bounce back that you'd like to see?
Yes.
So you'd be keen to see events return?
Yes. Next year.
Chief Minister, are you happy with the manner in which the cut-offs to business assistance has been announced, and are you happy that there seems to be a cut-off at 80%? Should we have more time for things to taper?
Sure. Well, look, the Commonwealth will announce things the way they do. They like to drop things to certain media outlets, and that's their mode of operation. That is what it is. I'll just let that one be. In relation to the tapering, well, look, we have obviously been able to negotiate for certain industry sectors that have a longer tail impact, support that goes beyond the 80% threshold, and then we've made some decisions ourselves independent of the Commonwealth Government to continue support for certain industry sectors up until Christmas, end of the year, and then some schemes are in fact continuing into the first quarter or the first half of 2022.
And ever since its outbreak and businesses assistance has been extended to business, the government's been criticised for one thing or another, not lending enough support, being too slow. Has that criticism been justified?
Well, I said from the outset that the Commonwealth's pathway to deliver assistance by state and territory governments administering grants schemes was amongst the least efficient ways, because we had to establish a whole set of new protocols and arrangements when we didn't have a direct relationship in terms of a payment mechanism for business. So we wouldn't have to be in the business of collecting bank accounts and ABNs and the like if we weren't having to run this scheme, and the Commonwealth already has all of that information. So it was not the most efficient way to deliver the program. The most efficient way to deliver the program would have been through the Commonwealth Government payment mechanisms. Now, this is not an argument that we wouldn't have contributed 50%. It's not an argument about who pays for it. It was an argument about the best method of delivery. And I've said a dozen times, and I'll repeat it again today, no, a grants scheme like this is amongst the least efficient ways. But the Commonwealth would not agree to use their payment mechanisms, which ironically they did last year for JobKeeper and JobKeeper Mark II, but they refuse to now. So that's my frustration. I share the frustration, but I said all through last year that a grant scheme was going to be cumbersome and take time and be administratively difficult. And that's absolutely right, it is. But we've got a big team working 7 days a week to make these payments. And obviously what helps that team is having the information they need to make the decisions, and they can just make the payments pretty quickly if they've got all the info they need.
31 cases today. The intention is to lift the lockdown on October 15. If we continue to see those sorts of numbers, is that reason to reconsider lifting the lockdown on October 15?
30 cases, no.
Is not an issue?
No, it's not.
Is there a level at which you would?
I wouldn't speculate on that, no.
Okay. Can I just get some clarification on one of the restrictions that will be eased from October 1 around 2 people being allowed to visit another household? So that means that 2 parents couldn't bring a young child into another household. Is that correct? And if so, what's the
if there's a caring responsibility that would mean that young child would be left without any supervision, then it is appropriate. And I see the age of the child is a factor in that. So the public health directions do allow for those sorts of circumstances, but this is not an opportunity for someone to bring 10 people into a household or 4 people into a household. People need to be sensible about this.
So it's a young, if it's a baby.
Of course, yes.
Sure.
Yeah.
A question about modelling. Earlier on in the week, you mentioned that there's an expectation that we could see cases in the hundreds as we move through the plan. I presume that's based on modelling. Can you confirm who conducted that modelling and what it's based on?
So you will have seen, obviously, I've referred to it, and a number of other jurisdictions have referred to Doherty Institute generic modelling of different population sizes of a sample population of 500,000, of 2 million and of 5 million. I think they chose those thresholds because that largely would reflect the situation for the smaller jurisdictions of Tasmania, ACT and NT at the smaller end, and then the 2 million size is sort of SA and WA, and then the 5 million plus are your New South Wales, Victoria, Queensland type indicative things. They're not absolute. They're sort of set at those levels. That modelling though assumed opening up at 70% double dose. And with low public health social measures in place, and a level of test, trace, isolate and quarantine. So every model has a series of assumptions. So you'd need to adjust down from that generic modelling of a population of 500,000. Although obviously a factor for the ACT is that whilst the territory population is around 435,000, the Canberra region population would be around 500,000, obviously depending on where you draw the borders of a broader Canberra region. So it's a good indicative sense. Now, we are of course not fully opening at 70% double dose, and we will not have low public health social measures in place. So that modelling, which was predicting thousands of cases each day, is then adjusted down in terms of both the population and the number of cases, daily cases that you would anticipate.
So Tasmania yesterday, which is a population that's slightly larger than the ACT, but comparable. So they released some modelling, so that the national modelling per capita, were they to open up at 80% yesterday. So that's 14,900 cases over the next 6 months, 590 hospital admissions, 97 in ICU, nearly 100 deaths. Is that comparable to what you guys are seeing for the ACT?
That would be, again, depending on the assumptions of the model, they would have drawn that from, as I understand what the Tasmanian Premier said, drawn that from the national modelling. They were then seeking to do their own model for Tasmania based on the unique circumstances there, so an older population but more spread out than your average Australian jurisdiction, with a 90% vaccination rate, I think was what I've read, the modelling that they were commissioning.
So those figures were based on 80%, but now they're commissioning their own modelling.
That's my understanding.
So would the ACT consider doing that, commissioning their own modelling rather than extrapolating national data?
To the extent that our vaccination targets are higher than 90%, and we will get even higher than that, we can draw some very straightforward conclusions. It's very easy to do. I can do it from the podium to give you some indicative 2% hospitalisation rate for children. That's essentially the data that's available across Australia so far. So we will have 80,000 kids under 12 in the ACT who won't have access, 70 to 80,000 kids who won't have access to a vaccine. You can expect a hospitalisation rate of about 2% over a 6-month period. Amongst the unvaccinated, hospitalisation rates are around 10% of all cases. So clearly, the more people we vaccinate, the fewer adults will be hospitalised. I made the point in the press conference yesterday that for every 1,000 people that we vaccinate, that's based on the data so far going to mean about 100 fewer hospitalisations. And the intensive care rate is running at just around 1% of all cases. So for every 1,000 people you vaccinate, 100 less hospitalisations and 10 fewer people requiring intensive care. So that's why I think it's absolutely fundamental that regardless of 70 or 80%, you don't stop your vaccination efforts there. You try to get as close to 100% vaccination as you can. Now, the disease is much milder in children. all of the evidence supports that, and you don't just need to hear from a politician to that. You can go to all of the health and clinical advice on that front. But all of the reports that have been released, the analysis of the Delta strain so far indicate for kids, it's about a 2% hospitalisation rate. For adults, it's about a 10% hospitalisation rate. You just do the numbers then based on the ACT's population, and that gives you a sense of what it will be like over a 6-month period.
On vaccinations, you mentioned in your opening remarks encouraging people to stick with the one vaccine, not to try and change. Is that a problem that we've been seeing in the ACT?
No, but just in the context of the change now that we have reliability of forward Pfizer supplies, I just wanted to be very clear to people over 60 who've had their first dose of AstraZeneca, and indeed to people under 60 who've had their first dose of AstraZeneca, that you must have a second dose of the same vaccine. But, as I said, the very clear advice from the Commonwealth and what you see in their forward vaccination orders for next year is that people who've had the AstraZeneca vaccine would have access to an mRNA booster shot next year. But look, in defence of AstraZeneca, it actually provides a longer level of protection, it seems, than Pfizer. That's what the research is showing. So all of the vaccines are good, safe and effective. The bottom line is the people who are most at risk, and particularly adults, they're going to be the unvaccinated. You know, what will happen when the country opens up is that, as has been occurring already, the virus will transmit and follow where the vaccines aren't.
Just seeking further clarification on tomorrow's changes, as you pointed out to Dan before. So, for instance, a couple who have very young children, they perhaps want to visit the grandparents of those children. Yep. Are they able to take the children with them and still be counted under that cap, you know, provided the children were of a, you know,
well,
relatively
in that
young
instance,
age?
It would be better for the grandparents to come to the parents. So there's two people, the two grandparents come to the parents' house.
Sure. Some elderly people, though, may have mobility issues.
Sure,
yes. Would that be a factor that should be considered?
It would be, but again, the idea here is not to have lots of people in houses. I mean, the biggest cause of transmission of the virus is household close contacts. So let's not have this important opportunity for families to reunite face to face for the first time in a while be a super spreader event. Like, the last thing that I think any grandparent or parent, or indeed child or grandchild, would want to give the gift this weekend would not be a dose of COVID. So I ask people to bear that in mind. Now, obviously, if you are fully vaccinated, that significantly reduces the risk. But if there is any unvaccinated person in the household, then there is obviously a risk that if even a vaccinated person may transmit the virus, they may have it, they may not even know they've got it, and transmit it to an unvaccinated person. So we've got to be very cautious about this. It's not an invitation for multi-generational large family gatherings, but it is an opportunity for parents and grandparents to spend a bit of time together. But, you know, it's much safer to do it outside, and it's much safer if everyone's vaccinated.
Your government today has made a very big announcement about climate funding for the next budget. Given the economic pressure that the ACT is under, given from the pandemic, why is this a priority?
Well, these announcements are very important to not only address climate change, but to create jobs and to reduce household cost of living. So we are going to enter into a phase where the government will need to go full throttle to support economic recovery. And so we will be pumping hundreds of millions of dollars into the Territory economy over the coming years in order to support the strongest possible economic recovery that will support the maximum number of jobs being created across our economy. Now, they're going to be created in the public sector, in the private sector, in the community sector. This is what we need. We need a massive turbocharge of our Territory's economy. It's been a tough 3 months. And what we want to see is a really strong economic rebound over the Christmas period, and that be sustained through 2022 and beyond.
Are there particular cohorts or population groups in the ACT that are proving problematical from the point of view of transmission and vaccination?
We have pretty strong take-up across the community. Where I would identify areas of challenge amongst the non-English speaking sections of our community and people who don't regularly engage with government. And so there is a section of the community who obviously don't have a fantastic level of engagement with government, with service delivery and the like. So we have been very fortunate to have a really strong delivery partnership with community sector organisations that's been essential in delivering public health to vulnerable communities and communities that aren't reading websites, aren't watching press conferences like this. Yes, that's that's been a factor across all cities in Australia and around the world. I mean, the most likely way that you are going to contract COVID is from someone close to you, someone who you live with, or someone who's a close friend or relative. That's been the bulk of transmission in Canberra and will be the bulk of transmission into the future as well. So that, I guess, is to reiterate the warning earlier that unfortunately that's where most transmission occurs. So when people are getting together over the long weekend, got to do so in a really safe and considered way, because you don't want that reunion to be a COVID transmission event.
How will you be boosting vaccination rates within those cohorts?
There's been a series of both specialist vaccination programs run in reach, so going out into particular settings to provide opportunities. So we take the vaccines to people rather than requiring them to come into our mass vaccination hubs. Clearly the role of GPs and pharmacists at a local suburban level is very important to provide access to vaccination. Our community sector delivery partners have been really fundamental to getting vaccines to people in a variety of different settings. And we've worked with multicultural organisations as well to provide opportunities for people to get vaccinated. We've had an access and sensory dedicated clinic for the disability community in Canberra as well. So we've looked at a wide variety of ways to deliver our vaccination program and also to deliver the public health messages that are so important at this time.
A key part of the government's strategy over the next coming weeks.
It already has been and will continue to be, yes.
Just on household transmission, you've made a pretty compelling argument about why that's a risk. Given that, why are you allowing household visits as almost the first major step in the easing of restrictions?
Well, it wasn't the first major step. We've obviously eased restrictions 3 times prior to this one.
But it is the most significant thing in terms of
no,
change.
I wouldn't have thought so. No, I think there's been other more significant moves. And not to downplay that it's not significant, but we are now 2 months into the lockdown and our vaccination rates are very high. But yes, every easing of restriction is a risk. Absolutely. But Dan, over the last several weeks, not you, but many people who've come into this room and thumped the table demanding that things be eased even earlier. And I've always said that there is a balance of risks here. That every time we ease and more people move around and come into contact with each other, that's an increased transmission risk. But what counterweighs that or counterbalances that is the vaccination rate. But this nation has torn itself apart over whether to open at 70%, 80%. We've got media outlets running agendas. It's been a vicious public debate. Awful things have been said about public health officials, about politicians. It's been the nastiest public debate I've experienced in my career in politics. Worse than marriage equality, worse than voluntary assisted dying. This has been incredibly hard on everyone. And emotions run very high. Understand all of that. And throughout all of this, what we are trying to do is balance public health outcomes, economic outcomes, mental health and wellbeing outcomes. But what I'm stressing today is that, yes, we have eased restrictions, but it's 2 people. And, all of your questions today have been, how can it be more people? But it's 2 people, and we want to try and do this safely. Why is it 2? So that we don't have outbreaks of 20 or 30 household close contacts. That's why it's 2.
Question for the Health Minister.
Any
That's
more
right.
from me before?
No, thanks.
No? Okay, thank you.
Just a case of someone who's applied for a medical exemption to come to an appointment in the ACT. We've heard from someone that's wanted to come from the South Coast to come to a cardiology appointment, applied for an exemption a week in advance, was asked to provide more information, did so. On the day of the appointment, the exemption was rejected. Are you aware of that case? Can you explain why that might have happened? And then secondly, is there any issues at the moment with a backlog in terms of processing exemptions, which is meaning there is delays in processing, and we have cases where they're being rejected or approved on the day of the appointment?
No, I'm not aware of that particular case, and we're always happy to follow up individual matters if we can get the details of that and identify why that might have been the case. For people who are seeking exemptions to enter medical facilities, there are 2 processes. So there is a process around getting the Clinical Health Emergency Coordination Centre has a process for the exemption to enter a medical facility, and then there is the exemption to be able to enter the ACT from outside of our local postcode areas. The exemptions team here in ACT Health that's responsible for that latter process actually has done a real blitz and got right through their exemption requests. My understanding is they are now up to date. That team processes hundreds of requests every single day. They've been doing an astonishing job with a vast range of exemption requests, and they do prioritise those that are associated with needing to enter the ACT in the next 72 hours. So I do sometimes get feedback from people that they put in a request a week ago, but they don't actually need to be in the ACT for another few days, and that would be quite a normal part of the process. Occasionally, it does mean that sometimes people's requests don't get processed in time because of all of these processes that need to be done. But I can't comment on the individual circumstances of this case. I haven't been briefed on that. I'm always happy to follow up with people, though, in terms of why a particular circumstance might have been that might have occurred, and it may in fact be something related to the medical professional that they were seeking to see as well, or a particular LGA that they may be coming in from that's high risk. So there are a whole range of different circumstances that get taken into account for those exemption processes.
Concerned at all if this happens to people repeatedly, that they might just sneak into the ACT, that they're so desperate to get in to make sure that they can get to their appointment that they do flout the rules?
So one of the things that our healthcare facilities do is actually check whether people have an exemption to enter the ACT and to enter the healthcare facility before they will go ahead with their appointments. So we have previously had examples where people have stated that they were told that they couldn't enter the healthcare facility when they arrived in the ACT, even though they believed they had a valid exemption. So there are a whole range of circumstances that have come to our attention that reflect really the complexity of the exemptions process, but also the role that the ACT health system plays in supporting our surrounding southern New South Wales region. And then on top of that, the fact that many health services in the ACT are provided by healthcare specialists who come from Sydney, for example. So sometimes there will be a complex mix of a patient coming from our region and a healthcare professional having to come from Sydney, and both of those exemptions having to come together for that to proceed. So I don't expect that people would be entering the ACT on the hope that they will get in, but I am aware of someone who has waited at the border for their exemption to be processed, and that was indeed done in time.
We're hearing reports of a COVID-positive individual heading to a party this week. Are you able to provide any more details on this?
No, I'm not able to provide any details in relation to that specific matter. I'm aware, occasionally we do find out about people having been at gatherings that are not allowed under the public health restrictions. The most important thing when we become aware of those things, particularly when it involves a case or a contact, is that people understand that they can provide all of the information that our contact tracers and case investigators need in a trusted environment so that we can undertake that case investigation and contact tracing. But obviously, if police need to be alerted to any activity that is outside the public health restrictions, that also occurs. But I haven't been briefed on this particular matter that you're raising.
And so you can't confirm whether it did or did not happen?
No.
Minister, you spoke briefly on radio this morning about the possible mandating of vaccines. Is there a particular scenario in which you'd see this coming into effect for what particular sectors?
Well, obviously we've talked about the potential process for mandatory vaccination for healthcare workers. Aged care workers, it's already mandatory, and healthcare workers is the subject of national discussion. And as the Chief Minister has previously indicated, disability support workers is also the subject of current consideration by the Australian Health Protection Principal Committee, and that will go back to National Cabinet in due course. The process that we're undertaking with unions and staff at the moment in consultation, and I've talked about this a couple of times at previous press conferences, is a consultation about if there was a decision to apply mandatory vaccination to any area of the ACT public service, how would this be implemented? How would it work? How would we ensure that those people who choose not to get vaccinated or who are indeed unable to get vaccinated are treated fairly within that process? And what would all the consultation look like once an area of the workforce has been identified? But beyond healthcare workers, we have not identified any area of the workforce that we would be having that specific conversation with at this point in time.
So have you identified a trigger point for this?
So this is also a combination of our work health and safety responsibilities that sit with each Director-General. So each Director-General is responsible under the Work Health and Safety Act for the health and safety of their staff and the people who come into contact with their services. So that's one element that is part of the consultation with unions and staff, is how would we consider those work health and safety responsibilities, and if someone determined that for work health and safety responsibility reasons they considered that vaccination would be mandatory for a specific set of the workforce, how would we implement that? And then there is the mandatory vaccination decisions that might be made by the Chief Health Officer as part of the public health emergency and her responsibility to make public health directions to mitigate the impacts of COVID-19 as a public health issue. And that would be, and then the sort of similar processes in terms of implementation might occur, but the process of determining the workforce would be a different one.
Still ruling out mandating vaccines for teachers?
I'm not sure that we have ruled that out. I think we've said we're not considering that at this point in time, and when that is still remains the case.
Health Minister, where is the surge in new cases coming from? Is it coming from people not adhering to the public health measures?
I think as the Chief Health Officer and Deputy Chief Health Officer have talked about a number of times, there are a range of different things that are leading to us having new cases. There are a number of cases every day that are household contacts of existing cases, but they may not necessarily have been in quarantine during their entire infectious period, because the period of incubation for the Delta virus can be so short. You can become infectious very quickly. You can infect someone else before you've been identified as a case and they've been identified as a contact. So they may have been out in the community during this period of time. That may then lead to an entire new chain of transmission to other people in an essential workplace, for example. So we've seen that on construction sites where we've seen a number of clusters coming out of construction. We've seen it in disability services. We've seen it in the aged care setting. So in those essential workplaces, we're actually seeing those new chains of transmission because people aren't identified as a contact of an existing case until they themselves are infectious.
So you're not Are you worried about cohorts like multicultural community or people in public housing or vulnerable settings?
So we're always wanting to support people who are going to have difficulty in maintaining their quarantine to ensure that they can do that safely. But it's not an issue of any particular part of our community. This virus doesn't discriminate, and we've seen cases across the broad cross-section of our community, and people are infectious in the community for a wide range of reasons. So we work very hard with our most vulnerable people in our community to ensure that if they are a case, that they can safely isolate, or if they're a contact, that they can safely quarantine. And that's part of the reason that we've set up the new quarantine facility in O'Connor, to ensure that where we identify, and we have been using ANU for the same purpose, to ensure that when we identify somebody who's going to have particular challenges in maintaining quarantine, they may, for example, actually be homeless, they may live in a house with a lot of other people, and it's going to be very hard for them to maintain isolation from those other people in their household, and for those other people to safely quarantine, then we provide an alternative form of support for those people. So that's exactly why we've established the facility in O'Connor, and it's a different type of facility than ANU, which, for example, would not have been appropriate for a large family group. Dan.
Are you aware of an outbreak associated with a childcare centre in Queanbeyan?
Yes.
Can you give us any further information?
No, I'm afraid I can't give you any further information in relation to that, but I'm sure we can come back to you with anything that we can provide.
Are there, just on that, are there any cases that are related to the ACT, or is it purely in Queanbeyan and regional New South Wales?
I understand that there is a relationship with the ACT, but again, I can't give you any numbers or details in relation to that.
For Summer-Nats coming up, what sort of capacity limits are being explored, and will the government impose a double vax requirement for such large events?
So we have previously indicated that we don't have an intention of introducing a mandatory vaccination requirement for events, but all of those things are going to be worked through with Summer-Nats, and I don't have any particular information on that. I'm afraid I don't have visibility of that conversation. The proprietors or the event organisers would be working with the Chief Minister's Treasury and Economic Development Directorate on some of those issues. They are the events managing directorate. So it might be a question you want to put to the Chief Minister tomorrow.
No worries. And apologies if this is better sent to the Deputy Chief Health Officer, but the ICU case that came in overnight that's being added to tomorrow's numbers, were they moved from hospital into ICU, or are they an additional case coming in?
I'm not able to answer that, I'm sorry.
No worries.
Yeah.
Can we speak to the Deputy Chief Health Officer quickly?
She's gone to our HPPC. Okay. Yeah. Thank you.